California has long had an image as a haven for marijuana users. This film from comics Cheech and Chong poked fun at California's marijuana counterculture of the 1960s and 70s. For some users, marijuana is freely available today. Here it is sold at a San Francisco dispensary known as MetaThrive. The clinic's operators say they provide marijuana to patients with a recommendation from a doctor, something that is legal in California but illegal under federal law. In nearby Oakland, the Harborside Health Center is an even bigger marijuana dispensary, serving 600 patients a day. With 30,000 members, it has more than $20 million in annual revenues. It follows California law, providing marijuana for a wide range of ailments, says founder Steve D'Angelo.
When a patient comes to us for the first time, we first, of course, verify that they're a legal medical cannabis patient. And then we ask them to sign an agreement. And in that agreement, they elect to become a member of our collective, and they authorize all of the other members of the collective to grow cannabis on their behalf.
People wanting to set up their own marijuana clinics can learn how it is done at nearby Oaksterdam University, founded by Richard Lee.
Once they take their politics and legal issues, then they can go on to taking courses on horticulture, cooking with cannabis, hash making, bud tending, management, starting your own business, incorporating, things like that.
Los Angeles has more than 800 cannabis clinics, more than Starbucks coffee shops, or public schools. Some clinics are licensed by the city, while others opened under a loophole in the law. City officials say many of these clinics are illegal, and they have vowed to shut them down. Most police officials in California are adamantly opposed to the spread of marijuana clinics. Police Chief Kim Rainey of the city of Covina says he believes marijuana may help some sick people, but he says it is probably a very small number, no more than 2% of users.
The people with cancer, MS, a variety of medical conditions, there are certain components inside of marijuana that probably provide them some relief. We take no issue with that. The challenge is the other 98%, by our information, that it's just turned into a way to legitimize recreational marijuana use.
Bill Britt worries about the drug being restricted. He suffered from polio as a child, and he says marijuana helps him reduce the use of other medications. He medicates several times a day with a marijuana vaporizer.
I would probably be using some kind of painkiller, some kind of muscle relaxer, some kind of anti-spasmodic, some kind of anti-nausea, some kind of antidepressant. There's just so many lists of drugs.
Some California doctors say marijuana helps their patients.
But some of the people have had amazing stories. I had one fellow who was paraplegic who had excruciating pain.
Dr. David Bierman recommends marijuana for a variety of conditions, including chronic pain. Some users want marijuana restrictions loosened even further. The National Organization for the Reform of Marijuana Laws, or NORML, held a recent conference in San Francisco, attracting advocates, users, and clinic operators. The group's founder, Keith Stroup, says marijuana should be legal for recreational as well as medical use.
There is absolutely nothing wrong with the responsible use of marijuana. It should be of no interest or concern to the government. Frankly, we need to stop arresting and start respecting responsible marijuana smokers.
Stroup and many other marijuana users say the drug should be legalized. They say marijuana should be taxed and regulated like alcohol and tobacco. But opponents of marijuana legalization say that should not happen without a national debate. Both supporters and opponents of marijuana clinics agree that current laws governing the use of medical marijuana are confusing, and it will be up to the courts to decide how widely available marijuana will be. Mike O'Sullivan, VOA News, Los Angeles.